Hey guys, welcome back to Medical Coding with Blue. All right, so I am finally going to do the demonstration of the encoder that I'm using at work. If you notice the time, okay, I wanted to make sure that this is on here. This is during my lunchtime, so just so you know, this is going to be really quick, but I am on my lunchtime. So let's go ahead and get started. This is what the standalone looks like on the encoder. So you may have some instances where you're going to be using the system, and then you can use the standalone if you are doing something else separate and you're not wanting to open up a record or whatever. So this is what the standalone looks like, okay? I went ahead and just put hypertension in here so that I can get it started and we can kind of go through and it won't have to prompt me all these questions. So this is just a dummy thing. I just put in like 32-year-old female. Okay, this is not, there's no information on here, okay? This is just a standalone, so no patient information. But let's go ahead and get started. So I hit the diagnosis, right? Well, it's asking me for primary diagnosis, so I'm going to go ahead and put in hypertension again. So since I know that code by heart, it'll pop up like that. All right, any edits that you have, the 3M nosology edits will pop up right here. But let's not get into that too far, okay? Let's see. So I'm going to go here to add diagnosis. Now, I'm going to demonstrate what happens when you have two separate diagnoses, and choosing a different path in the tree will lead you to a different diagnosis. So we're going to go with abnormal coagulation profile. This happens with patients who are like on long-term use anticoagulants. So I'm going to put, I'm going to start with abnormal findings. Okay, and so it'll say abnormalities. I'm going to go with number 4. And then I'm going to go findings without a diagnosis. Okay, number 6. Okay, and then what I'm looking for is not listed here because it's not in the blood, okay? If they have an abnormal coagulation profile, it's the clotting time, okay? So I'm going to go to E where it says spell other abnormal findings, E. And like it's technically called an abnormal prothrombin time. So I'm going to put PT. See, it says prothrombin time. I always kind of flub up that word. So I'm going to select number 1. And then you see how there's coagulation defect and then there's other unspecified. So I'm going to show you what happens when I select other, because we don't have a definitive diagnosis. It's just like a result of a lab. So we're not going to code anything else. Okay. So I'm going to hit the not other, and then I'm going to hit do not wish to code or already code, number 1, and then it's going to give me that diagnosis. Okay. So we're going to go through it again. We're going to go abnormal, number 4, and then we're going to go coagulation. Well, hold on, let's go back. If we go PT again, right, prothrombin time, and we're talking about a coagulation defect, I'm going to select number 1. Okay, we don't have anything else. We're not going to use anything else right now, so I'm going to put unspecified. Well, if you have a patient who has a condition like a factor deficiency, then you can select that. But for the purposes of demonstration, we're just going to go with unspecified. And then it'll ask you blood and or blood forming disease and or immune mechanism disorder with, and it says screen will repeat. And so do not wish to code or already coded, because in our fictional scenario, the patient does not have an autoimmune disease or nor do they have HIV. So we're going to hit number 1, and there's your code. You see, there's 2 different codes that come up. So this is where I'm saying that you guys have to understand what you're reading, okay? Because if you have a patient who has an abnormal coagulation profile, but there's nothing else wrong with them, it's just an abnormality on a lab, then that's the one you're going to pick. That's the R code, because that's like for more of your symptoms and things like that. It's nothing that's definitive just yet. But if you have a patient who has an actual blood clotting issue, you would be able to select this D code, okay, because that's identifying this as a coagulation defect. So make sure that when you are looking in the provider's documentation, the provider is being clear whether this is an abnormal coagulation profile or like abnormal tests, or if it is actually the patient has a legitimate defect, okay? And we'll go over one more example. Let's see here. So we're going to go with add diagnosis. And let's just say the patient is a tobacco user, okay? So we're going to go with user. Use of, number 1. We can select alcohol, amphetamines, and then letter J is tobacco. So then it'll bring up complicating pregnancy, childbirth, or the porphyrium, history of nicotine or tobacco dependence, or other unspecified. Let's just go with other unspecified, number 4, okay? And then problems related to lifestyle. It's prompting you these other questions because sometimes these other questions also are a part of this issue. So we're not going to talk about education and literacy problems or employment or anything else like that. So, or social, environmental problems. We're just going to put do not wish to code or already coded, number 1. And then it says use of, because the screen will repeat. So it's going to ask you, is there anything else like caffeine or cannabis or, cocaine, things like that. Just different, everything that's listed here are all the choices that you have. Or you can put other unspecified if there's something else, or other stimulant not listed above. Sometimes that'll happen. I remember when bath salts started being a huge thing. They had to do something like that where it was separate. So a lot of people would use that, and so it would just depend on what it is. So we're just going to select do not wish to code or code more. Then it's going to give you tobacco use, okay? But if you knew that the patient was a cigarette smoker and was dependent on cigarettes, you can put, we can go tobacco, nicotine. You can put abuse, dependence, and I said in this scenario that the patient is dependent, okay? So we're going to go with number 2. And it says with counseling and or surveillance, complicating pregnancy, personal history of, or we can put other, number 4. With disorder, because sometimes like these are tied to mental disorders. So if that was the case here, if the provider documented that this was related to, then you would go down that path. But we're not going to do that because this is just a demonstration. So then you can select chewing tobacco, cigarettes, or other tobacco product. That example would be the e-cigarettes or like vaping, okay? But we're just going to select cigarettes, so number 3. And then, or if they didn't specify, you can select unspecified. And then it'll say cigarette dependence specified as in remission, uncomplicated withdrawal, other nicotine disorder, unspecified disorder, or other unspecified. I'm just going to select other unspecified, okay, number 6. And then it's going to repeat. It says tobacco dependence with, and it's going to give you these other options. If it's a problem during pregnancy or toxic effects of nicotine, no, we're just going to put do not wish to code or already coded, number 1. And there you go, F17 to 10. There's your cigarettes. But if you ever wanted to go back and look at how did you get a particular code, you can always click right here where it says history, and it'll give you the whole tree of where you went. Okay, so we went tobacco dependence, and then other unspecified, specified as cigarettes. Now let's say that we want to select the e-cigarettes or like the vape. We can select that here and it'll jump us back. So it'll say in remission, uncomplicated withdrawal, or other stuff here. And so we're just going to put other unspecified, and then do not wish to code or already coded. And it gives you that code, the F17290, which is what you would select if the patient was doing e-cigarettes or vape. Okay, so I am going to go ahead and close this out. But I hope you all have enjoyed this very brief demonstration. Again, I'm on my lunch break, but I did promise that I was going to show this an example of how to use this. I can hit continue here so you guys can see this. And you see right here, it'll show all the diagnoses that were selected. And then if there's any edits here, you see right here where it says R79.1 should never be used at the same time as D68.9. And that R71 is the abnormal coagulation profile. And it's telling you that you can't put these two together. Okay? Because this is more definitive. And obviously, if you have a coagulation defect, you are going to have, in this instance, it will be an abnormal coagulation profile, okay? That's not uncommon for a person who has a coagulation defect. So I would take this away because it's telling me I can't put those two together. And you see the edit goes away, okay? And again, we're looking at this other edit here. Z72.0 should never be used at the same time as F17290 because that's telling you there's tobacco use and then there's this specific nicotine dependence. So if I take this code away, because this one is more definitive than the tobacco use, you see how all the edits go away? But watch what happens if I say that the patient is also a cigarette smoker. So since I already know that code off the top of my head, F17210, see, there's no edit. So you can put certain codes together, okay? Because sometimes people who use cigarettes will also do vape as well. And so if there's more than one type of tobacco dependence listed, then you can pick up however many accordingly, because I've seen some people who dip, do vape, and smoke cigarettes. So they would be able to pick up all of those if the provider is addressing that for that patient. Okay, so again, I'm going to go ahead and close this out, and because we are right at noon, okay, and I got about 15 more minutes, so I will go ahead and close this up. So I hope you all have enjoyed this, and I will see y'all on the next video. Bye!